Good afternoon, and welcome to today's webinar, Keeping Patients and Families on Track, How University of Minnesota Masonic Children's Hospital is leveraging mobile technology before, during, and after surgery. My name is Leah Brooke. I'm with Get Well Network, and I'll be the operator on this call. Before we begin, I want to take you through how to use the GoToWebinar platform. All attendees are in listen-only mode. If you'd like to ask a question, just type your question in the question box, which is located on your navigation pane, or you can click the Raise the Hand icon. You can ask a question at any time during the webinar, and we'll take questions during the last 10 minutes of the call. If you experience any technical trouble, you can always chat me directly through the chat function. It is my pleasure to be joined today by 5 hosts from our Get Well Network community. On the line from University of Minnesota Masonic Children's Hospital, we have Jason Albrecht, Director of Patient and Family Support Services, Michelle Saka, Pre-Admission Nursing and Perioperative Clinical Liaison, and Sasha Sakras, Staff Nurse and Peri-Op. And from Get Well Network, we have Shannon O'Neill, Vice President of Pediatrics, and Jess Sewell, Product Manager for My Get Well Network. It is now my pleasure to turn things over to Shannon O'Neill.
Thank you, Leah, and thanks to everyone who joined us today. Today's presentation is centered around the innovative work that University of Minnesota Masonic Children's Hospital is doing to leverage the Get Well Network platform to connect with patients and families in a meaningful way before, during, and after surgical procedures. We are truly excited to share this work with you, and I know they are too. We do plan to leave some time at the end of today's discussion to answer any questions you might have. But before we dive into our case study, I just want to take 2 minutes to set what I think is some helpful context. At Get Well Network, our collaborative work with our client partners often centers around current critical challenges and how we might solve them together. I'm sure it's no surprise to you that a lot of our innovation work today is focused on extending our patient engagement success outside the 4 walls of the hospitals and clinics we work with. We all know it's more important than ever before to get patients and families engaged throughout the care continuum and for a multitude of reasons. Everything from avoiding readmission penalties to reducing anxiety around and getting people prepared for procedures to meaningfully connecting to patients and families when they aren't in our buildings. Today you're going to hear how University of Minnesota leveraged our My Get Well Network solution to meet some of the challenges around scheduled procedures. I wanted to make sure I took a minute to get everyone up to speed on our My Get Well Network solution. The simplest yet important version of My Get Well Network is what we call digital discharge. When patients and families leave our hospitals, outpatient clinics, or physician offices, they can have access from their own device to a comprehensive digital visit summary, which includes any patient education videos or medication information they received while in the facility, as well as any important discharge notes or other information. We can make this available for them inside of your existing patient portal, or it can live outside. Now, building upon that extended connection, our My Get Well Network Pathways edition engages patients across the care continuum like never before to keep them on track with their care plans. More than just a focus on education and satisfaction, our My Get Well Network Pathways include tools like personalized goals and challenges, text or phone call reminders, video and text messaging for providers, and a ton of tools to support care providers in connecting with targeted populations. Today we have a number of these pathways, everything from chronic condition management for adults and pediatric patients to procedural and service line specialty pathways, targeting some of our most challenging or costly patients. We continue to grow this library, and I'm guessing after hearing directly from Jason and his team today, you'll walk away with some ideas of your own on how the platform can help you meet some of your needs. So with that being said, hopefully that little bit of context was helpful to you, but let's get going to the real story of the hour. It's my pleasure to hand the reins over to our friends at University of Minnesota Masonic Children's Hospital. Let me just say sincerely thank you for sharing your work with everyone today, and thank you for your passion and your unwavering commitment to providing an exceptional care experience for all the families who walk onto your campus. It's really been an inspiration for our whole team to work with you.
Thank you, Shannon. We're really excited to be sharing the work that we're doing, and also at the end of the presentation here to have the opportunity to learn from the rest of the group that's online as well, because it's always a rich experience to be able to do that, kind of that two-directional sharing and learning process that we always can do with the community here. So getting started, my name is Jason Albrecht. I'll tell you a little bit about the hospital and how we embarked on this journey to develop a strategy for pediatric surgery. And then we'll get into the actual specifics of what we put into the My Get Well Network solution that we developed. But we are the University of Minnesota Masonic Children's Hospital, and easily seen in our name here. I'm seeing if I've got mouse control here for a second. If I click to the next slide. There we go. Now it's working. We're a 246 comprehensive quaternary children's hospital, and we are part of the University of Minnesota Academic Health Center, as well as something called the Fairview Health System, which is a statewide system of hospitals in the Minneapolis-St. Paul metropolitan area, as well as around the state of Minnesota. At our campus here, where we have Get Well Network, we have it in our entire children's hospital and are in the process of moving from having our Get Well Network on Get Well servers and moving it on to essentially a virtual network on our own servers. So we'd be ready to expand it to our clinics and some of our adult units as well. So we're at a real interesting and fun transition point where we're exploring new opportunities. And in the context of that, being able to look at My Get Well Network is a really, it's proving to be an important opportunity for us to look at how we can expand not just from the inpatient model that we've been doing, but also into looking at kind of the pre, during, and post engagement with patients and families. So we have 96 beds in our PEDS area. A little bit about the hospital as well. It was, our hospital was the first in the country to do a pediatric bone marrow transplant, and also the first infant heart transplant in Minnesota, as well as the first cochlear ear implant in a child. So a lot of interesting history here. Hospital is a little over 100 years old, and we have a pretty robust NICU as well, so 63 beds. We have a behavioral health unit as well as part of the hospital, and then but 96 acute care beds, which are med-surg, critical care, and bone marrow transplant. So getting into kind of how our story begins here, it all started with our realization that the big challenge we had was how can we develop a consistent strategy for preparing people for surgery. So we have a lot of kids that are moving through for surgery, and they're coming from a pretty broad area. So a lot of different clinics, not just our own clinics, but clinics outside of our system as well. And we realized that families were receiving surgery preparation from multiple sources within and without the organization, and that the information that they were getting was often incomplete. Sometimes they heard different things from different people. And then also, being that it's a large organization with multiple clinics, we realized the need to get everybody on the same page. And we also needed to look at all the different things that people are being taught and need to be taught so they are prepared for coming to the hospital. We had the question of how much of the really important information that they need to know can be condensed into a single consistent message so we have less variability. So it's important to take a minute to explain how we approached our design process. So this wasn't a process where we thought, hey, we've heard about My Get Well Network. How can we apply that in organization? We really took a human-centered design approach. And that's something that our hospital, a new tower was built in 2011. And it was a product of doing human-centered design where we engaged patients and families and primary stakeholders in really identifying what did we need this hospital to provide, how should it look, how should it operate. And so we had really deep engagement that way. And then when you think about why we pursue the human-centered design approach, it's really a continuation of that philosophy of patient family-centered care, whereas we all know patients and families are included as very important, engaged, and critical parts of the care team. But why wouldn't we also have them be part of the design team? So when we're looking at everything from patient education to care environments to workflows, if we're designing for patients and families, we really need to have them be part of that whole process. So talk a little bit about how we use that process for the surgery preparation strategy. A little bit on the theoretical background, too, for people that might have some interest in it. We use, I think, one of the models that best describes our approach is IDEO's human-centered design model. And the thing about the human-centered design approach to it is it sort of turns the standard design thinking on its head a little bit in that many organizations, especially healthcare where we can be pretty paternalistic, we first start with our administrators, maybe physicians and some designers, architects, kind of folks looking at what's feasible, what can we afford, what seems like it's within the mission, what seems like it would align with what's in the literature, and then the viability, how much can we afford, what can we afford to do over time with that. But what happens often is we skip our understanding of really getting to know what is the desired elements, what's the desirability of different things. So we don't want to be at risk of, if we build it, will they come? Before we even think about what we're going to build, we want to really have an intimate knowledge and understanding of what's desired, and not just by our administrators and our physicians, but also our frontline workers, care providers, and especially patients and families who ultimately we're designing for. And so by starting with desirability, knowing what you really need to be doing, then looking at feasibility, and then viability, not just as what you can afford, but what will people actually utilize and engage with over time. You look at where all those things come together, you find that sweet spot, and that's where the solutions that emerge that this model says are the approach to go. So in our work, we began with identifying who are the key stakeholders, and we began our process by engaging with patients and parents that were from our hospital advisory board, or the parent advisory board, as well as a kids council, which is a patient and siblings are on a separate advisory board as well. We also engaged with families that were currently admitted in the hospital after having surgery, as well as those that were in our waiting lounge during surgery. And by engaging all these different people and asking very open-ended questions about what sort of things would help make the surgery experience better for them. What were some of the challenges? What were some of the things that we did well? So we weren't just looking for the issues and problems. We were also doing that appreciative inquiry about what did we do well that we want to make sure that we don't lose track of. It wasn't just patients and families that were part of this process. We also engaged the surgeons and anesthesiologists. They had very unique and different perspectives on what was really important for people being prepared, as well as the perioperative nursing leadership and our staff nurses, then our child family life specialists who were very actively engaged in the preparation of both the kids and the parents throughout the experience. And when we looked at the primary needs of all these different stakeholders, we then put it through sort of an affinity diagram kind of a process where we looked at all of the unique things that were shared desirables, and that were some of the unique things that we needed to address, sifted it all down to what became our critical content list of whatever the strategy does, it needs to address these certain things. And then we created that into a problem statement so that we had really good direction of what we were doing. And the problem statement or goal, what we were really after here, I think it's best to just read it from the screen here, but we want to deliver very clear, concise, and timely preparation to families and do it in a format that was easily accessible exactly when they needed it. And the things that it needed to communicate were the NPO instructions. So when does my child need to stop eating and drinking? What are some things that can be done for infection prevention? So we have a lot of work with surgery site infections that our hospital is doing and bringing those numbers way down, but there's also a part that families could be part of. Arrival time for the hospital, sometimes families would hear the surgery time and sometimes they would hear the arrival time. So you want to be able to clarify that. Logistical details, how you actually get to the hospital, especially if you're coming in the dark. Preparing parents so the parents have tools to better support their children and they know exactly what they need to do. And then especially what can we be doing for helping kids feel prepared so that their anxiety is less. So our problem statement was really coming at it from the direction of how can we create an overall strategy that addresses these things. And we want to look at what would success look like. So ultimately our outcomes here are, one, we want people to feel prepared before they get here. We don't want people arriving with lots of inconsistent messages or uncertainties, concerns, anxieties. I mean, it's frightening enough that you have a child that needs a surgical procedure. So why add to any of that? So how can we optimize our whole approach to that? And then ultimately they're increasing patient satisfaction. One of the big things from the operational side is to be able to reduce the day of surgery cancellations as well as delays. And these are things that are often due to communication processes, families misunderstanding NPO kind of details, as well as understanding specifically when they needed to arrive versus when the surgery was going to be. So some of these things that we assessed we're doing a bit of a root cause analysis on what some of the problems are, things that really do come back to the communication and how well we engage people. So success would be also measured in the ability for us to reduce the cancellations and delays. And then also with the surgery site infections and reducing readmissions, these are probably going to be difficult things to actually attribute to the success of this strategy, but intuitively we know that this is a strategy that we're embarking on here that will have an impact on that as well. So putting it into practice, we're going to talk a little bit about how we started this journey. And I'll talk a little bit here with Shelley. Shelley is one of the people that works in our pre-admission nursing team that reaches out and engages to all families before their child comes into surgery. And she's going to talk a little bit about how we started a pilot. So before we ever got to the development of anything for the My Get Well Network solution here, we were looking at some of the more fundamental tools like videos that address the needs of kids and of parents, as well as checklists and things like that. So we wanted to pilot a use of some of those things, and we began it with putting all these things onto a web page, and then that's where a lot of Shelley's work really began when testing with families.
And so I'm currently surveying families in the waiting room when they're waiting for their child to come out of surgery, and to ask them if they've watched our, seen our webpage, watched our videos, and getting the feedback from them. Was it helpful? Was it not helpful? Things we could have done differently. And the feedback has been completely positive. It's been a very helpful tool for those who have used it. We're still working on getting more of our patient population to use that, and that's a challenge. But what we learned is that many people are responsible for giving out this information and in the initial preparation for surgery. There's schedulers involved, there's RNs, there's care coordinators, physicians, clinic nurses, our pre-admission nursing nurses as well as administrative assistants. And so whatever solution we pursue, it's going to be a challenge to get everyone to change their workflow, and that's what we've discovered in creating this webpage as well.
Yeah, it's been a fascinating process because we made some simple assumptions that it was really maybe a set of coordinators and schedulers that handled all this. We found out that across our organization, it's a huge group of people. It's maybe 100 different individuals when you look at all these different people. And coming from different kind of disciplines, they actually have a different scope or different perception about what's important sometimes. And so we realized that was another source of some of the variability in the messaging. So if they're being, some of the first touch points are maybe from surgeons, administrative assistants, they don't have the same perspective of maybe if it was a clinic nurse talking them through that, or definitely different from a PAN nurse. So we knew that we needed to come up with a more consistent message there. But that challenge, how do we get all of these different people to change their workflow? That was one of the big things that we learned there. So bringing that forward, after our pilot with the webpage, which is actually still going on as we validate the quality of our videos that we use, there's a video that is designed, it's children preparing children. There's another one that's a video that was designed to address the specific questions of parents that they would watch. And then there's a parent checklist that's involved with it, as well as other some printed brochures that people can download and read or print out about how to help your child cope with a procedure at various ages. So we were able to pull all these materials in, and this is how we're validating the content that we want to be able to put into the My Get Well Network solution. So we looked at various solutions, and we were already well on the way for this project before we started to look as deeply into the My Get Well Network opportunity. And that was when we were at the last Get Well conference and had a chance to meet with the groups and kind of dream big. We talked about, what kind of a solution could we use on the technology side to address various needs that we had for the surgery prep. And that began kind of a dialogue that was parallel to our exploration of the use of just a web page. And so we look at the question of, so why leverage the My Get Well Network process, and came up with a variety of reasons. So through our design process, we identified key criteria, and I apologize too, we have a lawnmower going past our window, so it is that time of year. But anyway, through our design process, we identified these criteria for a preparation solution. And while our web page does meet some of these, we're realizing now that it's falling short in some areas. Where a web page is passive, My Get Well Network allows a solution that is a little bit more active in how it engages. So some of the reasons that we came up with are that, one, whatever our solution is, it needs to be able to help us provide a consistent message no matter who's delivering it. We'd like it to be interactive, not just passive where people can look at it in whatever, some people might start at the top, some people might start at the bottom or the middle of a web page and not read the whole thing. But we want it to be interactive with people, so it helps guide them. And in that sense, too, having it be in the format of a curriculum where it has a beginning, it has a middle, and it has an end, and there's a logical flow to it, would be really helpful. We also wanted something, one of the design criteria from our patients and for families was they wanted something that they could visit at their own pace and at their own time, and they could revisit it whenever they wanted to, so not a one-time read kind of a thing. And also that it would be engaging with them throughout the entire care experience. So sometimes, historically, our preparation might be just the one phone call that they had with a scheduler or a preparation nurse, or maybe with the surgeon or the nurse that was in the clinic when they learned that their child was going to have the surgery. But now we have an opportunity to create a solution that engages people across the entire care experience. We also wanted it to be something that was really robust and agile. Sometimes you go through, many of you might have experienced this, where you go through all the work of producing a brochure and the time that it takes and the editing and the branding and printing and all that, and then a little while down the road you realize, wow, I wish we could change a paragraph here or there, and there's a bit of a process for that. But we want a tool that's agile. How can we make it so that we can tweak it along the way as we learn? So it's more of a smart tool in that sense. And then finally, that it's in step with the family's use of technology. And in here, I think one thing that we would add is that families were telling us that paper is nice. Sometimes you've got something right there in front of you, but they get so much paper and they shove it in a pile and they shove it away, and then they can't find it. And sometimes it's that morning when you're trying to get your child, you've gotten them out of bed early and they haven't eaten or drinking, and you're trying to figure out, how do I get to the hospital? Where's the front door again? Where did I put that map? Where did I put those instructions? And then it just adds to the stress. And so this way, it's in one place, it's easy to get to, and it's not paper. So these were the design criteria that we identified through our design process. And as we looked at the My Get Well network, realized that this provided a solution that did meet those things. And so as Shelley is working on assessing our current strategy with the web page, she's also going to be driving a lot of the work along with Sasha on how are we going to assess some of the outcomes of our pilot of the My Get Well network solution. So Shelley, talk a little bit about that.
So we, one of the champions of our web page and videos is a general surgery patient, a pediatric patient, surgeons and their staff, and they've been very supportive of all our work in this. And so there's a group of 4 pediatric general surgeons, and we've identified their care coordinator who is willing to help us implement this Get Well program, and because there's just too much other complexity with some of the other clinics that we have. So this is a group we've chosen to help us pilot this, to keep it simple and clean, and focus, like I said, on those 4 surgeons and a single scheduler, which will help simplify things. And then in the end, my plan is to survey those patients that have been given this opportunity to use this format for their pre-op education during and after their experience.
So we're really looking forward to getting this next leg of our journey underway as we look at how much more impact can we make when we've moved from a web page, which is more passive, to My Get Well Network, which was much more active and engaging. And through that process, too, we're able to validate the tools and the content that we're creating. So looking at this point, kind of in the midpoint of our presentation here, to focus a little bit on what are the lessons that we learned so far, and then let's jump right into the My Get Well Network content. So one of the big things that we learned is that the fact that we approach this as human-centered design really empowered our team to overcome some obstacles that we encountered. And one of them is that there's so many different people. I mean, you look at our anesthesiologists and the surgeons and the nurses in the peri-op area and leadership. Everybody had very strong assessment, very strong reasons for thinking that certain workflow should happen in a certain way. And one of the hard parts was, how do we get a consistent, agreed upon approach from everybody? Because they all had really good reasons why they wanted to have a different opinion on how to approach things. But when we brought forward the design information from patients and families, that is, when patients and families were able to tell us in their own words what it felt like, what the experience was like, how much it helped and how much it hurt when we had inconsistent messages or some ambiguities or gaps in any of the teaching that we did that they would realize along the way. When we put it in those really human terms like that, our leaders, our teams were able to come together and realize, you know what, we do need to come to some sort of a consensus on here. And this, I would say, was actually probably the hardest and the most time-consuming part of the whole project. We chewed on that for over 6 months, I would say. We ran into things like, well, one surgeon group might say, well, if you're going to prepare people for stopping eating and drinking at a certain point in time, I don't agree with that, so I probably won't use your whole approach. I'll just go back to this paper or have my scheduler tell them a certain different thing. And we learned that, you know, that's just not going to work. We need to have an ability to figure out what is the common denominator of all the of preparation information that can be shared with everybody so we get that consistent message. So we kept coming back to these different groups and coming back. And as the entire team gained a greater empathy for each other as well as for the impact of patients and families, we're able to really bring that message together. So I think it might be, you know, any of you who might embark on a surgery preparation strategies like this may encounter a similar kind of a thing. So we just wanted to share that, you know, be prepared for that and embrace it headlong because it's a great opportunity. We also learned about the complexities. You know, we talked a little bit about the number of different people providing education. We really need to drive towards simplicity and a consistent message here. So learning how complex it was for patients and families was also really a key learning. And the family's desire for digital information versus paper, and that's pretty across the board. And then one of the things is we got going on this, we got all excited about all the things we could put into a web page, all the things we could put into a video, we could put on paper, we could put on My Get Well Network. But we learned that from the parents who said less is more. First they said, explain why. Don't forget to tell us why, but then just tell us what we need to know. We have so much stress, and under stress, our learning curve is just not optimal. And so as much as you can sift it down to the basics, you know, it's really, really going to help. So those are some of the big things that we learned going through that. But let's jump next into an overview of the whole experience of using the app. And Shelley is going to walk you through that along with Sasha. Okay, the next slide.
So just getting started, as you can see from the graphics there, parents will receive an email branded for our organization inviting them to get started on their care program. When they first log in, they're greeted with a welcome message. The first module of the program serves as an introduction, letting them know how to access and navigate this resource and what to expect throughout the rest of the program. And then one of the first steps parents take in the care program is to sign up to receive text messages to support their preparation leading up to their child's procedure. These messages are dynamic based on the family's progress with the care program and their willingness and availability to engage. And this is where Get Well begins to differentiate from our web page approach. It actually reaches out to families and actively engages them. It's not a passive tool. So in preparing for surgery, the education that makes up the care program is divided into modules. Each module contains a series of lessons, and this framework helps break up the content into consumable segments, and it's flexible enough to allow us to create each individual lesson to best deliver the information. The education leading up to the surgery varies between text, videos, and comprehensive questions. Care tips provide a way to highlight key points and takeaways and can point families to additional resources on a topic. The lessons in our care program address how to prepare how to enable families to prepare while still at home and help their children feel prepared and less frightened. They also help everyone, child and family included, to take safety precautions prior to surgery. So in monitoring progress, my Get Well network transitioned our traditional paper checklist into a dynamic digital format. No more paper. The checklist reflects families' progress towards surgery prep based on their interactions with the care plan, responses to check messages, and direct input into the checklist. Parents are also pointed to the checklist through the program to keep it top of mind as they prepare. It meets one of our design criteria to pull out the need to know information so that it can be easily understood and followed. And as far as clinician visibility, the clinician dashboard enables our staff to assign the program, monitor our family's progress, and assign specific education based on the child's surgery or procedure. We plan to use a clinician dashboard during the pre-admission nursing call prior to surgery, in which we will leverage this interaction with the family and time allotted as an opportunity to check on their patient progress. For families who, whatever reason, missed using our tool, we can point them to it during the pre-admission call and walk them through the important parts.
Now we're going to talk about day of surgery education. What to expect from surgery. And now, so our families are here and their child has been taken into the OR. And I want to talk about how we traditionally delivered post-operative education. On the day of surgery, education typically begins with the post-op RN doing the discharge teaching in the PACU as the child wakes up. Often children wake up from anesthesia agitated. Parents are overwhelmed with new tubes and incisions on their child as they're seeing them for the first time in PACU. The combination of the two is less than optimal learning environment. Early on, we looked at putting an inpatient Get Well system in the surgery waiting lounge in order to begin post-op education as well as other safety net education while the child was having their procedure done in the operating room. We quickly realized that the limitation of this option, that it would be too much vital information too late in the process. This also would be difficult for the pre-op RNs to manage. With this app that we're sharing with you, parents will have the opportunity to pass the time while their child is in surgery, learning about their child's specific surgery, what to expect during recovery, and to help them feel prepared to bring their child home. This no way replaces a conversation about discharge care between the PACU RN and the family, but serves as reinforcement of information learned earlier. This app can also be used as a tool to make sure that our parents know how their child is expected to recover from anesthesia, the normal versus the abnormal, how to perform wound care, what to do if your child has nausea, fever, pain, or is unable to urinate. This will also serve patients with reminders for follow-up visits with surgeons and will give answers to general questions. It will help parents to intervene early should complications arise, therefore preventing a hospital readmission and providing improving clinical outcomes. It can also be used to evaluate patient experience. They can use their own device or use this on multiple devices or on their own computer. In different populations where physical therapy is required, all the videos that our Department of Physical Therapy prescribes can also live in this app, and they can rewatch those videos as often as they need to.
So that brings us to our next steps in our process here. As we mentioned, we are in the process of testing and validating a lot of our content pieces on our webpage, but we're going to be looking at June as a start date for piloting the My Get Well Network with our key group of our specialty surgeons. And then for measuring success, we're going to be gathering patient and family feedback in real time. So we're going to be meeting with them in the family lounge while their child's in surgery to get an understanding of how it helped them at that point, and then also engage them to look at, or engage them after they get home and have used the post-operative components of that as well. And then we're going to be looking at how can we track certain outcomes. So what kind of things do we see a difference in related to the delays in cancellations in surgery. And I think one of the really important things we're going to be focusing a lot on, how do we refine the clinical workflow to support this kind of engagement? How do we help everybody as far upstream as possible realize the opportunity that they have to prepare patients and families for a more successful surgery experience? And then as we learn from all of that, we are looking forward to coming back together with everybody in the fall and then sharing the results that we get, and then also engaging with anybody else that's interested in doing this kind of work so that we can learn together. So one of the things that we're looking forward to a lot is the kind of partnerships that we can develop through the Get Well community here. So with that, I think we are ready to turn it back over to our organizers for questions.
Thank you. A big thank you to Jason, Michelle, and Sasha. That was such a fabulous presentation, and your commitment to providing exceptional care is an inspiration. We are all looking forward to having you back in the fall. Before we take questions, in case anyone needs to hop off early, I'd like to provide our contact information. If you're on the line and you're interested in learning more and continuing the conversation on My Get Well Network, or with University of Minnesota, here are the ways you can let us know. We have a 4-question survey that will pop up after you exit the webinar, or you can contact Shannon O'Neill directly at soneill@getwellnetwork.com. So at this time, we'll now take questions. To ask a question, you can type your question in the question box. We'll take questions in the order they're received. And if we run out of time and we don't get to your question, we have them, and we'll be sure to follow up with you. Additionally, this webinar is recorded, and a copy of the presentation and recording will be sent out to you tomorrow. First question, how do I know if my hospital has access to My Get Well Network today?
Is that me? That's a great question. So we do have a number of clients that are already contracted for My Get Well Network, either digital discharge and or pathways. The best way to find out if you have that available to you today is to speak with your Get Well Network representative. They can go through with you what you have access to.
On average, how long does it take to go live with MyG?
Hi, this is Jessica Soles. So with an average implementation, it really depends on whether or not you are going with a digital discharge implementation or a pathways implementation. Generally, it can take anywhere from 4 to 6 weeks to spin up. It really depends on what the project plan and how complex it gets. But generally, it's pretty quick, and we can get that project flooded through the project team.
Is there an additional fee to use the pathway?
Great. So that's also a kind of a follow-on to the first question. So if you are already contracted for My Get Well Network or for My Get Well Network Pathways Edition, there is no additional fee at this time. When you're not contracted, and we should talk about that because there is an additional fee, we are actually doing starting a kind of a promotional cohort now. If you're interested in being part of our introductory cohort for getting the Pathways live today, certainly when you reach out, let us know that, and we'll talk through what that pricing looks like.
Are the existing pathways customizable?
That's a good question. So with the existing pathways we have out of box, we're using generally the out of box content, the Miller-centric or the Kids Health videos, but we can always swap those out if you have custom videos that you want to use, as well as the actual content itself. It can all be customizable.
Is My Get Well Network available in Spanish? What other languages are available?
Yep, My Get Well Network is available in Spanish. We also have Arabic, and in the future we're going to support a full host of different languages.
Is My Get Well Network linked to the patient's chart?
Yes, that can be linked to the patient's chart. It really depends on what your integration is today. If you are an inpatient hospital that has an orders and results interface, that information will be documented back through PLS, which is our patient life system. With My Get Well Network, if you're doing a standalone application, that would just be a separate integration to have that content back into the EMR.
Right, so, sorry, I think that's important. So outside the integration piece, just to understand that you can actually have My Get Well Network and My Get Well Network pathways without having Get Well Network inpatient.
Correct.
Right, okay.
You mentioned during the design process that you surveyed patients and families in the surgical waiting room and the pre-op area to gain information about design. What questions did you ask?
We asked some general questions. We're pulling out the little the tool that we use here at the moment, but general questions about feeling of preparedness for coming in. And then Shelley's got it. Maybe you can talk a little about that, Shelley.
Some of the questions we asked, if they had been here before, if they'd seen their surgeon prior to coming in, what categories on the web page seem would be most valuable and why. Anything else we should add to the web page, and then we broke it down into the parent video and the child video and asked, was it helpful for both? What parts of the video have been most important for you, and how did the length of the video feel for you? And for our non-English speaking families, we did address through an interpreter how well they felt prepared for surgery in general, just to get a feel for that. So we broke it down between the parent and the child video and asked basically the same questions of each.
We tried to keep the questions pretty open-ended and just see what kind of patterns emerged and the sort of answers that we got from people. And so from that process, we began to learn that people do like the digital approach to it. They really appreciated having something that was designed especially for their child to watch, that they could preview first. And then also for the parents, we kind of had a mental checklist going of all the different types of elements or critical content pieces we put into the parent video and how many of those elements were picked up on by the families and found to be helpful.
Thank you.
Does that answer your question?
Yes, thank you. Where does the email and phone number contact come from to reach out to the families ahead of surgery?
Where does the email and phone number come from to reach out to families ahead of surgery? So when families, the workflow that we're looking at is when families are, again, as far upstream as we can get this to start. So if they're in a appointment with their physician and learning their child's going to have surgery, we would like, if it's one of our clinics, for that team to be able to say, let us get you started up in this the care plan right now, and then they would open up the clinical dashboard and then be able to ask the family, with the family standing there, what email would you like to use, and then tell the family that now that I've entered this in here, you'll see an email that is starting our care program, and so please open up that email and begin. So we ask it in a conversation with the family early on. That's our intent anyway as we run our pilot for this. And then if that doesn't happen, so there's going to be circumstances. Again, we talked about how complex the variety of different people are that are doing the preparation. Our pre-admission nurses, when they do a call in advance of the kids coming in for surgery, is another safety net to reach out to the family by phone, by calling them directly and then asking them if they would like to engage with our care plan at that point.
Yeah, we have a variety of patients entering our system. On occasion, we have kids with broken arms that come in through the ED in an ambulance, in which case we would ask them to do the same thing so that they can learn about how to take care of a cast, how to monitor for complications of a cast like numbness and tingling and some other things that they would need to alert their surgeon about as soon as the complications happening, so that we don't lose a limb, God forbid.
Yeah, and there's a lot of learning that we're going to do along the way about the different ways and different timelines that patients come into our system. So the answer to that question might vary over time as we learn more.
We also have that information available in our patient demographics as well. So.
We have time for about 3 more questions. How do you support the families who do not have access to the mobile technology?
So for that, we would fall back on our traditional, which is if we know that they don't have access to it, we want to ensure that the content that we have gets to them in the form of paper. So our parent checklist is printed on paper. We have a brochure that walks through all the need-to-know points for getting ready for coming into surgery, as well as for helping your child cope. So our fallback is going to be the paper version of that.
Can the checklist items, for example, the perioperative checklist you showed, is that customizable?
Yes, yeah. So that is all customizable. Go ahead, Jason.
I was going to say, from our standpoint, one of our design criteria is that it would be. And so I think maybe I can let the Get Well team answer just how customizable it could be over time.
Yeah. And from our perspective, when we were working and partnering to design this, we built it in a way, the framework, so that it can be customizable and repurposed for other uses as well, so it can be customizable.
Okay, I think we have time for one more question. You mentioned getting some pushback from surgeons. Can you elaborate on how you iterated the information they wanted incorporated versus what everyone else wanted incorporated? For instance, NPO times. Did you get consensus or offer different instructions for each surgeon?
Yeah, that was the adventuresome part of this project, and we began actually with the surgeons, and then separately with the anesthesiologist, and then brought them together, and we created, from their perspective, a critical content list of points that families would need to understand, information they really, really wanted communicated to the families, so that we knew what are they looking at in terms of best practice, evidence-based approach to the care. That really is going to be the bottom line. But there were times when there was a little bit of discrepancy between what an anesthesiologist might think was unnecessary for NPO times and what a surgeon would. And so we needed to have a dialogue happen between those two different teams, and then make sure that what is in our actual hospital guidelines and policies reflects that. But where we found some need was to look at how do we then translate that to families. And so as we went through multiple iterations of bringing the criteria that the surgeons and anesthesiologists were saying to our parent advisors and to patients and families, getting feedback on, how much of this information can you actually retain? Does this make sense to you? What questions would you have after you heard this? We kept bringing that back to the surgeons and the anesthesiologists, and landed on, I think more specifically, some of the questions were, do you gauge when a patient should be NPO based on the arrival time they should end up at the hospital or the scheduled surgery time? And then they had reasons for, what if there's a delay for some other kind of a reason, or you can move them up earlier in the process so they don't have to wait so long for surgery. You can't move them ahead in the schedule if they haven't been NPO long enough. If it's the other way around, you don't want to have a young child being NPO too much longer than is medically necessary, because it's an uncomfortable experience for the patient. So the teams really deliberated back and forth on what is a standard that they can all land on, and then we work with patients and families and staff to figure out how can we translate the instructions for that so that it makes sense to them. And then also a little bit of variability sometimes in what they considered a clear liquid and not. So, that got a little bit interesting for us, I think, as we learned too, that some people would say coffee was a clear liquid, and other people would say apple juice, of course, is a clear liquid, but not orange juice. And so for families, though, that's hard. It's really hard to distinguish. How do you differentiate between coffee, orange juice, and apple juice when they're not all the same? So we tried to look at some of those messages as well and bring that level of detail back to our physicians, whether they're anesthesia or surgeons, in order to say, how can we reword this so it still fits with your best practice and safety? Because safety rules over everything in what we're doing here, but it has to make sense to the families. And so that was where we worked on the language with that.
And I just want to add that certain surgical procedures require very different bowel preps. From an anesthesia standpoint, it's safe to intubate a patient that's been NPO with clear liquids for the past 2 hours, then it's a go. But from certain surgeon standpoint, you need an extensive bowel prep of 24 hours of drink and go lightly and this and that. So this app can't give specific times that are universal for everyone, because certain procedures require different kind of NPO preparation. So for specifics, we still fall back on a phone call from our pre-admissions nurse who knows exactly what the surgeon's wishes are for this particular procedure, and that conversation is happening three to 2 days prior to surgery, and times, we go over those times pretty extensively.
The key way we really landed on our final solution for this is just constantly going back and validating what we understand to be a correct articulation of something with the families, and then bringing it back to the physicians until we had really good empathy and everybody could agree on this is the best way to say it. So again, it comes back to the outcome is actually dependent on how good your co-designing is.
I'm going to squeeze in one more question. What are your metrics for success with this surgery initiative?
The primary metrics that we're looking at right now, I think that the big three are: can we reduce cancellations, same day cancellations of surgery, as well as surgery delays. And those are all things that we have tracked over time. So we have baseline data for that, as well as satisfaction. So we have satisfaction tools that go out to the families after they've had a surgical experience. And so we'll be looking at elements of communication and other indices like that for patient satisfaction. And then also another one of the things is the surgery site infections. And while our surgery site infections the numbers are probably low enough that we might not see a measurable difference, we also intuitively are expecting that with the patients and families being more prepared to deal with the germs that are probably already on their body before coming in, that it'll have an impact.
And also reducing readmissions.
Thank you. If you asked a question and we didn't have time to get to your question, we have it, and we'll be sure to follow up with you after the call. At the end of the webinar, you'll see a survey that pops up. It's 60 seconds, 4 questions. We really appreciate your feedback. In the survey, you can submit additional questions or comments. I'd like to thank our wonderful hosts for taking time out of your busy day to share your story with us and with the Get Well Network community. This now concludes today's webinar. Thank you, everyone, and have a great day.